Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is July 24th, 2020. As always, we'll start with the COVID-19 statistics. Worldwide, we have nearly 16 million cases and over 639,000 deaths. In the United States, there are over 4.2 million cases and nearly 150,000 deaths. This week, we will start first by talking about vaccines. Doctors across the United States are seeing a decrease in the number of routine immunizations done. This was an issue even for the last few years because of the anti-vaxxer movement, but since COVID-19 has started, it's become an even bigger issue. The numbers have plummeted. This is mostly because people just don't feel safe going out, going to doctor's offices and things like that. The World Health Organization and we here at Plain English Public Health urge parents to get your children, take them to the doctor, get those immunizations done. Those routine immunizations protect children against diseases, many of which have higher death rates than COVID-19. So don't take a risk, get the immunizations done as soon as possible. Along similar lines, veterinarians are seeing an increase in the incidence of parvovirus among dogs. Parvovirus is one of those things that can also be prevented by a vaccine, and because of COVID-19 and people not going to their houses so much, that is why they've started seeing an increase in parvovirus. So please, whether you have a dog or anything else, any other pet, please get your pet to the vet. Get them checked out, get their vaccines done, take care of them. Now, speaking specifically about COVID-19 vaccines, the last couple of weeks have seen three major candidates for vaccines against COVID-19 move into the final phase of testing. All three of these major candidates work in slightly different ways, and we're not yet sure which way will work the best. It may be that we will need a combination of the three methods. We don't know yet. That's what these tests will hopefully find out. But the governments across the world are currently hedging their bets by signing purchasing agreements with the different companies so that there will be a number of different types of vaccines available once they've all been successfully tested, so that we can basically have a number of things available to beat back the virus as best as possible. It's amazing what technology has been able to do. Even just in the last 2 to 3 years, we've seen technology be developed which helps vaccines be created much more quickly. If it had been, say 3 years ago, the current vaccine against COVID-19 would probably have taken 2 to 3 years to make, possibly longer. But because of the technology just recently developed, we're able to have a vaccine by the end of this year or the beginning of next. So that's just amazing. One of the challenges so far in creating vaccines has been the fact that we don't even know yet whether the vaccines will work against COVID-19, or if it's one of those things where we're going to have to keep getting booster shots throughout our entire lives. That's one thing that these final tests are supposed to help us learn. But recent studies are suggesting that even if the antibodies do decrease or even disappear after 2 to 3 months, like what we've been seeing in a lot of the studies, even if that happens, there are other parts of the immune system, T cells and other things, that may still be able to remember the virus and kick up production of those antibodies as soon as it's needed. So it wouldn't necessarily mean that because the antibodies decrease that we wouldn't be able to beat back COVID-19 if we are faced with it again. Again, this is still early in the studies. We're not completely certain if that's the case, but it does show promise. So we'll learn more as we go through the vaccine studies and other scientific studies for the next few months. So like the last few weeks, we're going to talk a little bit again today about face masks. We should all know by now that masks work the best at protecting those around the mask wearer, not the mask wearer themselves. But recent studies are starting to show that masks do actually protect the mask wearer better than we thought. It's still masks are still definitely better at blocking virus particles going out from the mask wearer than those coming in, but The masks do tend to block a decent number of particles coming in also, and that decreases that viral load. And if you just don't get enough viral load, you're not going to get sick. So definitely wear a mask. Wear it for everyone else, but also now wear it for yourself. Another point that has been made recently is about vented masks. Typically you see these little vents on N95 masks, but trying to be trendy, a lot of the manufactured, buying them online type of cloth masks also include those vents. Those vents are usually, the N95 masks that have those vents are usually used in healthcare and other industries that need to block out harmful substances. The problem is with COVID-19, we're trying to keep asymptomatic people from spreading the virus out from themselves. And so those vents, they don't have any filtering in them going out. They only have filters coming in, or not even filters, they just block it coming in. It's a valve. And so for COVID-19, those vents actually do more harm than good. And so if you have a mask that has a vent, please don't use it, use a different mask. If you have no other mask, then I guess one with a vent is probably better than nothing at all. But please, as much as possible, try and get a mask without a vent. In Switzerland, doctors are warning, based on results that they're seeing in their own communities, that using a plastic face shield by itself is not effective at stopping the spread of COVID-19. There's just too much space around the edges of the face shield that can allow the coronavirus to get in and out. So don't use just a face shield. If you use a face shield, make sure you're using it in conjunction with a face mask. Because the face shield is good because it can also help with blocking virus particles and stuff from getting in your eyes, which a face mask won't help with. But again, by itself, a face shield just isn't enough. You do need to use it with a face mask. Since the beginning of the pandemic, we've been told that children are not as susceptible to the COVID-19 as older people, especially senior citizens. New studies in South Korea and elsewhere show that children might not be quite as safe as we once thought. While it's still true, according to studies, that children don't usually get as serious of symptoms as older people do, there are exceptions to that, and children aren't invincible. So please continue to follow the CDC guidelines and teach your children to do so also. These studies, however, focused more on the transmission of COVID-19. And so they looked at children, teens, adults, and tried to determine how easily each age group transferred the virus to other people and how easily the virus was transferred to them. What they found was that even though younger children, typically 10 or 11 years old and younger, they do seem to have a little bit of protection. They don't seem to get it as easily, and they don't seem to pass it along as easily. That part of the study was a little weaker, though, than the rest, just because they didn't have as many participants in that age range, and so it's harder to say if those results are completely valid. But they do say that it looks like that is the case. On the other hand, teens and tweens, basically from about 11 to 20 or so, they seem to be even more likely to pass the virus along than adults do. They seem to be, kind of like a super spreader type of thing. Again, each person is different, but in general, teens and tweens tend to pass it along the virus much more easily than other age groups do. So that being said, be careful. Use the CDC guidelines, use a face mask, wash your hands, use hand sanitizer. Just make sure you're not using the ones that are on the list that I gave last week and the week before that have the methanol in it. And also practice social distancing. We need to make sure we're doing that in order to keep everything, keep the virus away from everyone as much as possible. Also, regardless of how fast it spread or how easily it spread, any age group is still susceptible to COVID-19. Throughout the United States, and especially this past week in Texas and Virginia, we're seeing an increase in children. In Texas, there was one county that had 85 infants come down with COVID-19. Virginia has just been seeing a general increase among the population of children having COVID-19. So this may be related just to the fact that COVID-19 cases are increasing everywhere, and so the children are just being brought along with that. We're not sure yet. More research needs to be done on that. But please, everyone, regardless of age, be careful, follow those CDC guidelines. In non-COVID news, a new study has shown that those who get more of their protein from plant sources rather than animal sources tend to live longer, and they also have a lower risk of death from cardiovascular disease. Scientists still aren't sure exactly why that's the case. There's a number of theories, but basically all of the studies done recently on plant versus animal sources of nutrition have basically shown that while animal sources of nutrition, meat, eggs, things like that, are important, they need to be limited much, much more than plant sources. Plant sources should be the main source of nutrition for people. We end up being healthier that way, less obesity, less cardiovascular disease, just healthier all around. Also, although cinnamon has for quite some time been thought to lower blood sugar levels, only just now has a double-blind, placebo-controlled study been done. Now, that double-blind, placebo-controlled study, that's the gold standard among scientists for a study. That's the type of study that gets you the most accurate and most certain results. Now, this study, it was studying cinnamon versus blood sugar levels. It was not trying to figure out if cinnamon could reverse the effects of diabetes, and so we don't have any answer on that just yet since it wasn't designed for that. But it did see that taking cinnamon daily among pre-diabetic people can reduce their blood sugar in levels. In fact, it can reduce it to the point where they would no longer be considered pre-diabetic, and it keeps them from becoming diabetic in the first place. So that's definitely something good, because cinnamon is very abundant, and people, most people tend to like it. So one thing to worry about though with cinnamon is if you take too much of it, it can have some undesirable side effects. Most of them are not really serious, but still try and avoid taking more than 1 tablespoon of cinnamon a day. Mix it into baked goods, oatmeal, anything you want to put cinnamon in, basically. Just mix it in, just don't go over 1 tablespoon of cinnamon per day. Thank you for watching the Plain English Public Health Weekly Report for July 24th, 2020. I'm Richard Greenland, and you have a healthy weekend.